Alzheimer's disease is a progressive neurological disorder that affects millions of people worldwide. It primarily impacts memory, thinking skills, and the ability to carry out simple tasks. As the most common cause of dementia, Alzheimer's gradually destroys brain cells, leading to a steady decline in cognitive function. Early symptoms can be subtle, often mistaken for normal aging, but over time, the changes become more pronounced and disruptive. Understanding what Alzheimer's is lays the foundation for recognizing its impact on individuals and families, and highlights the importance of early detection and intervention. The early symptoms of Alzheimer's disease can be subtle and are often overlooked. People may start to forget recent conversations or events, misplace items, or struggle to find the right words. These memory lapses may seem like normal aging at first, but as the disease progresses, they become more frequent and severe. Other early signs include difficulty planning or solving problems, confusion with time or place, and trouble completing familiar tasks. Recognizing these symptoms early is crucial for seeking medical advice and planning for the future. As Alzheimer's advances, symptoms become more pronounced and begin to interfere with daily life. Individuals may have increased difficulty recognizing family members, become easily disoriented, or experience changes in mood and behavior. Tasks that were once simple, like managing finances or preparing meals, become challenging. The progression of symptoms varies from person to person, but the decline is typically gradual. Understanding this progression helps families prepare for the changes and challenges that lie ahead. Genetics can influence the likelihood of developing Alzheimer's disease. Certain genes, such as the APOE4 gene, are known to increase risk. However, having these genes does not guarantee that someone will develop Alzheimer, and many people without them still get the disease. Rarely, Alzheimer's can be caused by inherited gene mutations, leading to early onset forms that appear before age 65. Understanding the genetic component helps researchers develop better diagnostic tools and potential treatments. Diagnosing Alzheimer's disease involves a thorough evaluation by healthcare professionals. Doctors review medical history, conduct physical and neurological exams, and use cognitive tests to assess memory and thinking skills. Brain imaging, such as MRI or CT scans, can help rule out other conditions and detect changes in brain structure. Blood tests may also be used to eliminate other causes of symptoms. Early diagnosis is important for planning treatment and support. Alzheimer's disease progresses through several stages, each with distinct symptoms. In the early stage, mild memory loss and confusion are common. The middle stage brings increased difficulty with language, reasoning, and recognizing loved ones. In the late stage, individuals may lose the ability to communicate, require full-time care, and become vulnerable to infections. Knowing the stages helps families and caregivers anticipate needs and provide appropriate support. In the mild stage of Alzheimer's, people may function independently but start to notice memory lapses. They may forget familiar words, misplace objects, or struggle with planning. Friends and family may notice these changes even if the person tries to compensate. This stage is often when a diagnosis is made, and it's important to seek support and plan for the future. During the moderate stage, symptoms become more noticeable and interfere with daily life. Individuals may become confused about time or place, have trouble recognizing people, and need help with personal care. Behavioral changes such as agitation or suspicion can occur. This stage can be challenging for both the person and their caregivers, requiring increased support and patience. In the severe stage, individuals lose the ability to respond to their environment, carry on a conversation, or control movement. They may require round-the-clock care and assistance with all activities of daily living. Physical health declines, and complications such as infections become more common. Providing comfort and dignity is the main focus during this stage. A hallmark of Alzheimer's disease is the presence of amyloid plaques and tau tangles in the brain. Amyloid plaques are clumps of protein fragments that accumulate between nerve cells, while tau tangles form inside cells and disrupt their function. These abnormal structures interfere with neuron communication and contribute to cell death. Scientists believe that plaques and tangles play a central role in the development and progression of Alzheimer's. Alzheimer's disease affects every aspect of daily living. People may struggle with basic tasks like dressing, eating, or bathing. They might forget appointments, get lost in familiar places, or become easily frustrated. These challenges can lead to a loss of independence and require increasing support from family and caregivers. Understanding the impact on daily life helps in planning care and ensuring safety. Behavioral and psychological symptoms are common in Alzheimer's disease. Individuals may experience mood swings, depression, anxiety, or aggression. They might become suspicious, withdraw from social activities, or have trouble sleeping. These changes can be distressing for both the person and their loved ones. Recognizing and addressing behavioral symptoms is an important part of care. As Alzheimer's progresses, communication becomes increasingly difficult. People may struggle to find the right words, repeat themselves, or lose their train of thought. Understanding or following conversations can be challenging. Caregivers can help by speaking clearly, using simple sentences, and being patient. Nonverbal communication, such as gestures and facial expressions, also becomes important. Doctors use a variety of tests and tools to diagnose Alzheimer's disease. Cognitive assessments evaluate memory, attention, language, and problem-solving skills. Imaging tests like MRI and CT scans provide pictures of the brain to look for changes. Sometimes, spinal fluid tests or PET scans are used to detect specific biomarkers. These tools help rule out other causes and confirm the diagnosis. While there is currently no cure for Alzheimer's disease, several treatments can help manage symptoms. Medications such as cholinesterase inhibitors and memantine may improve memory or slow symptom progression. Non-drug approaches including cognitive therapy, exercise, and social engagement can also be beneficial. Treatment plans are tailored to each individual's needs and may change as the disease progresses. Medications for Alzheimer's disease focus on improving symptoms or slowing progression. Cholinesterase inhibitors such as donepezil, rivastigmine, and galantamine help boost levels of a chemical messenger involved in memory. Memantine regulates another brain chemical, glutamate, to improve cognition and daily function. These drugs may provide modest benefits, but they do not stop the disease from advancing. Non-drug therapies play a vital role in managing Alzheimer's disease. Cognitive stimulation, memory training, and structured activities can help maintain mental function. Physical exercise, social interaction, and a healthy diet also support overall well-being. These approaches are often used alongside medications to provide comprehensive care and improve quality of life. Caring for a person with Alzheimer's disease can be both rewarding and challenging. Caregivers often help with daily activities, provide emotional support, and ensure safety. It's important for caregivers to seek help, take breaks, and look after their own health. Support groups and resources are available to assist families throughout the journey. Caregivers of people with Alzheimer's face unique challenges, including emotional stress, physical demands, and financial pressures. Support groups, counseling, and respite care can provide relief and guidance. Connecting with others who understand the journey can make a significant difference. Remember, caregivers need support too, and seeking help is a sign of strength. Living with Alzheimer's disease requires adjustments and planning. People can still enjoy meaningful activities, maintain relationships, and find joy in daily life. Creating routines, using memory aids, and making the home environment safe can help. Staying socially active and engaged supports emotional well-being and may slow symptom progression. While there is no guaranteed way to prevent Alzheimer's disease, certain lifestyle choices may reduce risk. Regular physical activity, a balanced diet, mental stimulation, and social engagement are all beneficial. Managing heart health, avoiding smoking, and controlling diabetes or high blood pressure can also help. These healthy habits support brain health and overall well-being. Research into Alzheimer's disease is ongoing, with scientists working to better understand its causes and develop new treatments. Advances in genetics, brain imaging, and drug development offer hope for the future. Clinical trials are testing new therapies, and early detection methods are improving. Staying informed about research can provide hope and empower families facing Alzheimer's. It's important to distinguish between normal aging and Alzheimer's disease. While occasional forgetfulness is common as we age, Alzheimer's involves persistent and worsening memory loss that disrupts daily life. Normal aging does not cause confusion about time or place, difficulty recognizing loved ones, or major changes in personality. Understanding the difference helps with early detection and appropriate care. Family members play a crucial role in supporting loved ones with Alzheimer's disease. They help with daily tasks, provide emotional comfort, and advocate for medical care. Open communication, patience, and understanding are essential. Families can also benefit from education and support resources to navigate the challenges of caregiving. Planning for the future is important after an Alzheimer's diagnosis. Legal and financial planning ensures that the person's wishes are respected and that resources are available for care. This may include creating a power of attorney, advance directives, and managing assets. Early planning reduces stress and helps families make informed decisions. Despite the challenges, many people with Alzheimer's find ways to live well and enjoy life. Focusing on strengths, maintaining routines, and staying connected with loved ones can make a positive difference. Creative activities, music, and nature can bring joy and comfort. With the right support, it's possible to find meaning and fulfillment at every stage.